Okay, so good afternoon to our clinical instructor, Mr. Liuber Caranto. I am Joan Thomas from BSN 12, and I'll be performing the ophthalmic administration medication. So, may I start na po? So, for the topical drug medication administration, or specifically the ophthalmic medication administration, is that we'll have to know what is our goal. So, kung ano po ba yung purpose kung bakit natin ginagawa itong assessment na ito, that is to administer the medication in various growth, specifically the otic, the ophthalmic, and so on and so forth, that has systemic local effects. That is to treat illness, prevent infection, to alleviate pain, to replace any essential substances in the body, and then to destroy the tumors. So, in proceeding on the assessment is that we'll have to first gather the equipment. We have here the eye drops. Okay, we have also here the alcohol. We have the gloves. Okay, that is for hand washing and preventing the microorganisms. And after doing those, and so on and so forth. And after doing those, we have to know the medication order. So we have here the medication administration record, or the MAR of the patients. Okay. So according to the medication administration record, or the MAR, is that the patient will have to do an ophthalmic administration medication at a time of 3:50 p.m. in the afternoon, and also the effect of the medication is that it is anti-inflammatory on the eyes of the patient. It prevents the in any infections on the patient as well. So we have to know what is the if there were any inconsistency before, during, and after the patient take the medication. Okay, so also we have to observe for any side effects. For the side effects of this eye drop, or instilling the eye drops, is that the side effects of it may include the watery eyes, itchiness, swelling, and so on and so forth. So we have here also the improvised medication vest. I'll just wear it. I'll just wear it like this. Okay, so I'm showing that I wear it to the bottom. And of course, we have the administration purpose. For the administration purpose is that they instill any infection on the eye, and we'll have to perform hand hygiene as well. Then we should wear gloves. That is to prevent the spread of microorganisms. Then after we did this is that we will be knowing what is the 12 rights of medication. So for the 12 rights of medication is that we have the right client, right drug, right dose, right route, right time, right assessment, right motivation, right of the client to refuse to the medication as well, right to know the reason of drug, why are we administering the drug, the right evaluation, the right documentation, the right drug preparation. So for the variation in practice, so it may vary based on your institutional policy. The for the moving of the medication cart, or preparing the medication cart on the bedside of the patient, that is to that depends on the institutional policy of the hospital. Okay, so this is our medication card. If this employs on the institutional policy, we have to unlock the medication card. So assuming that I just unlock it, and then also I will enter the passcode. So I'll just enter the passcode just like that, and of course we have the employee identification. I'll just swipe it like that. Okay. After I swipe it, that serves as my employee identification. So after knowing to the system of the hospital is that we have to do the preparation of the medication one patient at a time. So because administering medication or assessing many medication on patients or many patients is that will give you a confusion and at the same time so much errors. Okay, so I'll just read the medication administration and I'll just read the contents. Also assuming that this is an improvised eye drop, so I'll just read the contents, including the expiration date, the milligram per milliliter. Okay, I'll just also compare the contents, the drug actions, and effects on the client when intake upon reading the MAR. And also on the patient's chart as well. Okay. So after doing those, is that we will have to so also the expiration date is also indicated, wherein the expiration date indicates that it will be expiring at exactly September 23 a year of 2025. Okay, so after doing those is that it varies on the institutional policy if it is going to be scanning or of the barcode, that is if it is required. Okay, so now we'll have to proceed on the explaining to the patient what we're going to do and identifying ourselves to the patient or introducing ourselves to the patient. Okay, so good afternoon, sir. I am Joan Tomas, a student nurse from the Wesleyan University of the Philippines, and I'll be your nurse from 3 p.m. to 7 p.m. in the afternoon. So, sir, for verification, may I know your name? Okay, so may I also know your age? May I also know your birthday? Okay, so also, for verification, may I hold your hand to check your ID band? Okay, so it says here that there were no allergies on the patient. There were also no allergies on the medication administration or the patient's chart of the patient. Okay, so sir, don't worry, this is for safety purposes. Okay po. Okay, so everything that will be conducted and recorded within this assessment will be fully confidential within me and the attending physician that I'll be referring you to po. Is it okay po with you, sir? Okay. So, sir, what we're going to do is the administration, medication of the ophthalmic area, or the ophthalmic medication administration. So, we'll have to instill eye drops, few drops on your eye. Okay. So, that will be included. So, I'll just explain also the outcomes, the drug action or the response in the effect of the drugs. Okay, so, if I instill the drops on you, so, it may cause a watery vision or a blurry vision at first, and then, it will serve as an anti-inflammatory, and it will prevent any infection on your eye as well. Okay, it will cleanse your eye. Is it okay with you, sir? So also, there were also side effects of this ones, including that is the blurry vision and also itching, swelling, okay, some part of swelling that may also depend on how you, but don't itch it or don't scratch it, okay? Even if it is itchy, treatment, the drug medication, or the drug action, is that we'll have to ensure that the medication is appropriate or in related with the room temperature. Okay, so assuming that I am adjusting the room temperature at the appropriate or the accurate certain Celsius or degrees of this eye drop. Okay, so right now is that we'll have to perform hand hygiene before doing those or before giving it to the patient. So, but I just finished the hand hygiene. So, right now we will be proceeding on the sitting or lying position. So, sir, may I assist you po as you sit? So, after we sit, we assist the patient in a sitting position, so that we'll have to instill the eye drops. Before instilling it, you should clean the area. So assuming that this is a saline water, so I'll just instill water on it. So can you close your eyes po? From inner to outer canthus. From inner to outer canthus, I'll just use separately cotton balls again for the other eye. Okay. Inner to outer canthus, from inner to outer canthus. So after doing that, is that we will have to proceed on the assessment. We have to have the patient upward. Okay, so look upward po. Okay. So I'll have to instill, assuming that this is an improvised eye drop. Okay. So, okay, blink po tayo. Gently. Okay. So another po. Okay, blink po tayo. So this position is approximately 1 to 2 cm from the eye and on the position of my finger. Okay, so then after we did that, is that we'll have to instill a drops that on the lacrimal ducts that will have to apply a gentle pressure about 30 seconds. So we will not be having will not be applying any eye ointment on the patient, but if ointment is applied, is that we will have to clean the laxolacrimal while cleansing the area. Okay, so after that, I'll just have to put pressure on your lacrimal duct. Okay po, that is for 30 seconds. So assuming that 30 seconds have passed, okay, so I just use another cotton ball for the other eye. So assuming also that 30 seconds have passed, okay, I applied gentle pressure on the lacrimal duct area. So also I also wipe the eyelids for excess medication. Okay, and after doing those, is that we'll have to assist the patient in a comfortable position. So, sir, comfortable po ba kayo nakahiga or nakasit na lang po? Ay, nakasit na lang. So, comfortable po ang ating patient in a sitting position. But after that, if the patient wishes to into a supine lying position, so we should do it. And of course, we have to perform hand hygiene by removing our gloves. medication administration record, that the patient does not have any allergies at all, and then for the evaluation or any abnormalities, indications of any abnormalities, and then also as I evaluate the patient, as I observe the patient, and the body's response, specifically the ophthalmic area, is that I observe that there is no allergies beyond the time frame that the patient should react. Okay, so again, thank you to our clinical instructor, Mr. Leo Vercaranto. I am John Tomas from S1